time permits, you can, if time permits, you can unmute yourself to speak and then to ask your questions. All right, nice to meet you. Yes. Please let us know your name, your organization, and then where you're joining us from. I already introduced myself. Yes, you can do same. You just tell us your name, where you're joining us from. Awesome, awesome. Thank you so much. All right. Okay, I can see Florence from Nigeria. Thank you so much. Happy to have you all on the call. I can see wonderful, great women on this call today. Uganda, Charles from Uganda. Francina, awesome. Welcome. Thank you so much for joining us today. All right, so we'll move to the lunch proper. Yes, it's 12 minutes past 12. And I can see Clotilda. Hi, Clotilda. Happy to have you here on the call. All right. So you're all welcome to the Gender Equality Fund Initiative profile launch, the Nigeria country profile launch. Before we go proper, we want to get receive opening remarks, to get the welcome remarks from our wonderful Her Voice Fund manager. We'll be getting welcome remarks from our wonderful Her Voice Fund manager. Cindy Amaiza is our manager on the Her Voice Fund project. We are happy to have her on the call. Cindy, if you're here with us, if you can just unmute to give us your welcome remarks. Please use the chat box to clap for Cindy as she comes up. If you clap for her, she's going to come up faster. So you can just use the chat box to clap for Cindy as she comes up. Thank you. Over to you, Cindy.
Thank you, Agnes, and for the very huge welcome. Today is a very good day. I feel like we are finally here to launch some of the very important work that we have been doing for a very long time. Right from the process that we have gone through, from working with the different partners, different adolescent girls and young women, different consultants, different stakeholders within Nigeria and in all areas, just to ensure that we actually understand what is the current situation for the that AGYW are in terms of their programming for HIV, TB, and malaria, and also how all this generally intersects, how gender intersects with all this, to ensure we can actually program for them better and make their program in itself better, to ensure that their voices are actually being heard in all decision-making processes, whether at national level, whether at the state level, whether at the local government level. Where are they and how can we then reach them better to just be able to support them to actually implement their programs, their initiatives? For me, this is a huge thing coming up. This is actually one of the things that I started to work on when I joined this team. And so I'm very glad that it's being launched. I can actually see some of the AGYW who are interviewed here. I can actually see some of the stakeholders we worked with throughout these processes. So I am actually very happy that we are at this stage. And other than that is to say thank you to all our partners, the AGYW that we work with, our stakeholders in Nigeria from the different departments, inclusive of UN Women, the CCM, and all the other partners that we have worked with in this process. We are really grateful that you welcomed us with both hands. We were able to walk into your office and talk to you and have conversations with you about what is the current level of programming, where are AGYW getting their help, how are they able to influence these processes, and even how important they are in terms of their meaningful engagement. How are we engaging them? How are we able to then to also reach them in a better way? So we are really grateful for this opportunity that you took with us and you are able to be with us at all times. I think for me, that is the greatest thing that I would want to say at this point, and to hand it over back to you, Agnes.
All right. Thank you so much, Cindy. Powerhouse. I think Cindy is our powerhouse. You can see how wonderful women are doing wonderful work in the development space. Thank you so much, Cindy. You can see we are putting in all the effort to ensure that adolescent girls and young women are put in decision-making platforms, not just at the state level. You can hear her loud and clear, state level and even at the national level. Thank you so much, Cindy, for that wonderful welcome remark. I will quickly have the overview of the Gender Equality Fund Initiative, because maybe some people are lost. Okay, what is the Gender Equality Fund Initiative all about? Okay, what came about the launch of the country profile? How did we go about it? So we'll have the Gender Equality Fund Program Officer, Grace Saba. She'll be giving us an overview of the Gender Equality Fund Initiative and a little brief into what we're about to launch today, the Nigeria Country Profile. Thank you so much. You can also clap for Grace in the chat box. Thank you so much, and over to you, Grace.
Thank you so much, Agnes. Good morning, good afternoon, everyone, depending on where you are joining us from. I'd like to specially welcome you to this important occasion of the Nigeria Country Profile launch. My name is Grace Saba, and I'm the Gender Equality Fund Officer with Y Plus Global. Next slide, please. What is the Gender Equality Fund about, and why is it such a timely initiative? We know that women and girls in Nigeria and in many parts of Africa experience different forms of discrimination and inequalities because of their gender. And when it comes to adolescent girls and young women, the discrimination and inequalities are multiple and intersecting because of different factors, including gender, age, HIV status, disability, and even sexual orientation. And that is why the Gender Equality Fund is here. We have also seen that when it comes to issues that affect adolescent girls and young women's health and rights, they are often sidelined in these important decision-making processes. Therefore, the Gender Equality Fund is a consortium of the Global Network of Young People Living with HIV, also known as Y Plus Global, TB Women, and the Civil Society for Malaria Elimination. We also have a country lead in Nigeria, which is the Africa Network of Adolescent and Young Persons Development. And we are working together to collaborate with adolescent girls and young women and their organizations in their diversity to design, to implement, to influence, and advocate for gender transformative programs, policies, and approaches to health, with a focus on HIV, TB, and malaria. We're working with AGYW organizations to ensure that adolescent girls and young women are leading in the design of their projects, ensuring that they are addressing the root causes of gender inequalities when it comes to access to healthcare services. And they're able to transform healthcare in the way that they want to access or see it in Nigeria and in Africa. And our key objectives include scaling up the Her Voice Fund model to Nigeria. Now, the Her Voice Fund model has been operating for 5 years across 13 African countries. And we took lessons and outcomes from this fund to scale to Nigeria, where we are providing small grants to adolescent girls and young women-led organizations across 6 states in Nigeria, namely Kaduna State, Benue State, Lagos, Oyo, Akwa Ibom, and Rivers State. This is an important step because we are addressing the funding gaps that AGYW-led organizations experience, because oftentimes their community groups or even unregistered and may not meet the traditional requirements of donors. And so we're bridging this gap. We're also supporting AGYW in our diversity in Nigeria to exert influence and advocate for integrated gender transformative policies and programs. This is to ensure that adolescent girls and young women are meaningfully participating in decision-making spaces that affect their health and rights. And aside that, we're also strengthening technical capacity, because it is one thing to provide these opportunities for adolescent girls and young women to participate, but it's also another thing to ensure that they are well equipped and empowered to participate in these spaces, ensuring that their needs and priorities are brought to bear. And we're providing this capacity strengthening through the Leadership Academy led by our consortium partner, TB Women. Next slide, please. Now, moving on to why we are here, which is the Nigeria Country Profile. The development of the Nigeria Country Profile was an important first step for us in the implementation of the Gender Equality Fund, because the Gender Equality Fund is beyond, is not only for AGYW, it is also by AGYW. And we wanted to ensure that AGYW were meaningfully participating from the onset. We wanted to ensure that we had an understanding of their needs and priorities, and that these needs and priorities were also guiding the implementation of the Gender Equality Fund. And so late last year, we commissioned a consultant to develop the Nigeria country profile. And this profile provides an evidence-based overview of the status of adolescent girls and young women in Nigeria in relation to HIV, TB, and malaria. And it also analyzes the gender challenges and barriers that AGYW experience when it comes to access to healthcare services, with focus on HIV, TB, and malaria. We looked at the policy environment and also supported AGYW to identify 3 key aspirations for improving health outcomes and overall well-being for AGYW in Nigeria. Now, this process involved a desk review, which provided epidemiological data on HIV, TB, and malaria in Nigeria as it affects AGYW. We also had focus group discussions, which involved 55 adolescent girls and young women from the GEF 6 target states, and key informant interviews, where we interviewed critical stakeholders from the government, including the Federal Ministry of Health, the National Tuberculosis and Leprosy Control Program, the UN Women, and also the Nigeria Country Coordinating Mechanism. Next slide, please. Now, these are the key features of the Nigeria country profile. As I mentioned earlier, it provides data on the prevalence and gender-related drivers of HIV, TB, and malaria as it affects AGYW in Nigeria. It also provides an analysis of the existing national policies, the gaps that exist, and how it affects adolescent health rights and well-being, and also the key aspirations for AGYW to guide GF advocacy in Nigeria. I'd like to mention that these 3 key aspirations that were developed by AGYW guided the applications for the GEF small grants in Nigeria, and are also the 3 key themes that the GEF grantees are focusing on with regards implementation. I'd also like to share that presently we have 15 GEF grantees across the 6 target states who started implementation early this year. Next slide, please. Thank you. Now, looking at the key results, we'd like to focus on the gender-specific barriers that were identified from the country profile. And these include stigma, cultural norms, early marriage in the North, and gender-based violence as key hindrances faced by adolescent girls and young women with regards to accessing HIV, TB, and malaria services. I'll read a quote from one of the FGD participants in Kaduna State. And she said that, when I have to go to the facility to collect my drugs, he stopped me because he has no idea where I'm going to. And I lied to him that I'm going somewhere else when he found out that I'm going to a facility to access the drugs. This is an evidence of the reality of most adolescent girls and young women in Nigeria, especially in communities where adolescent girls and young women require consent from a male member of their family before they're able to go out or access healthcare. Results from the legal and policy environment also recognizes AGYW as vulnerable groups and the importance of addressing their health and rights. But we have also seen that in Nigeria, or from the results, adolescent girls and young women are seen as a homogeneous groups. And so when it comes to programming for their health and rights, they are lumped together as one group without critically addressing the the needs and priorities of different categories of adolescent girls and young people. We also saw an enormous gap when it comes to implementation and enforcement of policies that affect adolescent girls and young women's health and rights. Next slide, please. I would leave you with the three key aspirations that were developed by adolescent girls and young women. As I mentioned earlier, these key aspirations continue to guide the implementation of the Gender Equality Fund in Nigeria. And first is to scale up integrated and youth-friendly health services, where adolescent girls and young women are requesting for strengthening the integration of HIV, TB, malaria, and SRHR services, ensuring accessibility and availability. And secondly, to transform leadership and decision-making in AGY programming, ensuring that AGYWs are not seen as beneficiaries, but as co-creators, where they're also leading in these decision-making spaces and contributing meaningfully to their health and well-being. And lastly, to enhance policy implementation and legal protections, ensuring that there is an enabling policy environment. And beyond that, policies and laws are implemented so that adolescent girls and young women's rights will remain respected, protected, and fulfilled. Thank you so much for your attention, and we welcome you to download the full copy of the Nigeria Country Profile, which will be shared with you in the course of this launch. Thank you so much again, and back to you, Agnes.
Ooh, I think others are unable to clap, so I might just be the one to do the clapping from my own edge. Thank you so much, Grace. Thank you for working, holding our hands, and taking us through the process, just giving us an overview of what the Gender Equality Fund Initiative is all about. I like that. Thank you so much. If you didn't take home anything, just know that we have about 15 grantees, 15 organizations that are working with adolescent girls and young women. So we are doing a lot of work. We are doing wonderful work in Nigeria for adolescent girls and young women. So the program is not just for them, but it's being led by adolescent girls and young women. Thank you so much. I don't want us, Grace just give us a hint of what we are to expect when the profile is officially launched. So stay tight, stay seated until the launch. So we'll just hear quickly. I will be saying there was a process that led to the development of the country profile. We said there were stakeholders, Grace made mention of stakeholders that took part in the development of this country profile. And we also said there were some adolescent girls and young women that took part in this process. So we'll have few of them. We'll have just two of them who will just share their experiences with us. They are wonderful young women doing amazingly in their respective states. Just two of them will share their experience, what it was like taking part in the development of the Gender Equality Fund Initiative and country profile, what their experience was, the impact, the change that taking part in this discussion had in their lives, not just their lives, and even for their peers as well. So we'll have Temitope Adegoke. Temitope is on the call. She'll share her experience with us, how it was taking part in the development of the Gender Equality Fund Initiative country profile. And then we'll also have Augustina Elisha, who also share her experience with us. Sit tight and you enjoy the process. Hi, Temitope, are you here? If you can just raise up your hand so that we can locate you, and then we'll give you the mic so you can speak. Thank you so much. Hi, Temitope, are you here with us? I know I saw you a few minutes ago. Just raise up your hand. Hi, Temi. I know I saw Temitope a few minutes ago. All right. So I'm still looking for Temi, but for the interest of time, Augustina Elisha, if you are here, if you can please share your experience with us. Okay, Temi is here. Temitope is here. She said her hands are up. I can't see the entire participant list. So you can unmute yourself. Please unmute yourself, Temitope. Joseph, if you can please drop your hand so we'll know who is raising his or her hand. So Temitope, please unmute yourself and speak. All
Okay.
right, all right, all right, great.
Okay. Good afternoon, everyone. My name is Temitope from Association of Positive Youth in Nigeria, Oyo State. And I'm honored to share my reflections on Nigeria country profile launch on gender equality. Some months back, during the focus group discussion, through this experience has made me to gain a deeper understanding on the complexity surrounding gender inequalities in Nigeria. And I also want to appreciate the opportunity to engage with others, adolescent girls and young women in other states. Hearing their perspectives and sharing my own insights has really opened my mind and my thoughts to challenges that adolescent young girls and young women are facing in our community. So from this experience that I take part in the focus group discussion, working with other young women, the focus group discussions feel like a safe place for me to share my thoughts and experience. And I felt that my participation also contributes to the country profile development because I shared my own thoughts and concern. And as a young woman, my own opinion and alongside with other young women and adolescent girls from other states at shaping the country profile that has been used to implement gender equality fund initiative. I don't know if you can hear me. Hello?
Hi, Tammy, we can hear you loud and clear. You can go on.
All right, thank you. So my participation contributed to the country profile development process by bringing a unique perspective and expertise to the table because I was able to share my knowledge and my experience, which has helped to shaping the profile recommendation and strategies. My engagement with other young women and adolescent girls also facilitate a collaborative and inclusive approach to the profile development. So this is just like a kind of a take home note to our stakeholders and decision makers that are on this call. I would like to speak with the Global Fund in particular. Please, I will urge you to prioritize gender equalities and women empowerment in Nigeria in development agenda. I would like you to invest in initiatives that promote women economic empowerment, education, and health, and ensure that policies and programs are inclusive, equitable, and responsive to the need of all Nigerians, particularly young women and adolescent girls. Let us work together to create a Nigeria where everyone has equal opportunities to thrive. Thank you. I'm over.
All right, thank you so much, Temitope. I like that. You know what? There's something about advocacy. Regardless of the platform that you find yourself, you try to advocate for those changes you want to see. And I'm happy as we acknowledge, oh, Global Fund is on the call. They are our journals and they're on the call today. Temi Tokbe has a message for Global Fund. Thank you so much. I know everybody cannot clap for Temi, but I'm clapping for Temi, and you can also do the same in the chat box. Thank you so much, Temi. That was wonderful. Awesome. Thank you, all your daily precious. All right, let's quickly hear from Augustina Elisha. You can just raise up your yes, Global Fund. I've heard you. Georgina is clapping. Thank you so much, ma'am. Augustina, if you can please raise up your hand so we can locate you and then you can unmute yourself to speak. Please raise up your hand, Augustina. Thank you. Thank you. Okay, I can see Augustina, but you can just raise up your hands. I don't know if I'm the one not seeing it from here. All right, I think I can see Augustina. If you can unmute yourself, please do. Please unmute yourself. Tawanda, please, if you can give access to Augustina to unmute. Please give her access.
Can you all hear me?
Yes, we can. Yes, ma'am. You can go on. We can hear you loud and clear.
Okay. My name is Augustina Elisha from Kaduna State, and I happen to be one of the adolescent girls and young women that took part in the focus group development of the country profile. Okay, my experience with that focus group discussion was wonderful, and it actually felt like a home, like a safe place where I could share all my problems and challenges with my fellow women, like engaging and wonderful. And it was wonderful to see these initiatives under this gender equality initiative putting into consideration. And I really get the hope that a lot is being done. These are and women are part of this consideration in making decision platforms. And I've started experience in the FDD. I've started doing my capacity as I took part in some gender equality fund activities that are supported by the TV conference under this same fund. And my take home to our shareholders, I will speak directly to our global fund and our Kaduna State policy makers per se that supporting initiatives like the Gender Equality Fund can promote really inclusive and empower all our voices in Kaduna development and the country at large. Thank you.
All right. Thank you
Hello,
so
can you all
much.
hear me?
Yes, we can. Thank you. Are you still speaking?
Yeah, thank you. I'm done.
Okay, thank you so much. Let's clap for Augustina as well. Let's clap for Augustina. Let's clap for them. You know, it's not easy. Yes, our voice fund manager is clapping. Awesome, awesome. You say women supporting women. I can see Temi Talk by also clapping. Thank you so much. Thank you for sharing your experiences, for bringing it home. You know, whenever we are saying advocacy, and we are looking at the national level, the international level, it's great to always bring it back home because advocacy starts with us. Advocacy, we always encourage that advocacy should start at the grassroots level, right? So we are bringing it back to Kaduna State. And now this message is not just for Kaduna State. We're implementing the Gender Equality Fund initiative in about 6 states. We're implementing in Kaduna, we're implementing in Benue, Lagos, Akwa Ibom, Rivers, Benue, Lagos, all the states. It's a message to all our stakeholders in those states. Awesome. Thank you so much for sharing your experiences. I know so many young women also want to share their experience. If you're on the call and you also want to share your experience, you can just drop that in the chat box. We will really appreciate that. You can still drop your experience in the chat box. Thank you so much. All right. So, you know, we mentioned that we had stakeholders that took part in the development of the country profile, right? And then, you know, they will usually say it's great to hear from some of the stakeholders. Let's to get their feedback from the stakeholders. Oh, Blessing wants to share experience. You can just drop that in the chat box, Blessing. Don't worry, if there's time, I'm going to read it out. Just share your experience in the chat box, Blessing. We'll still see it, and I assure you I'm going to read it out. So you can still share your experience. I like that. I like the energy already. Awesome. So we'll be having a panel discussion with some of our stakeholders that took part in this. There were parts of the people that supported us through the development of the country profile, and some of them are also those that are currently working with us on the Gender Equality Fund initiative. So, I don't know if I can get the next slide where we can see our wonderful panelists. Yes. Awesome. Awesome. Now it feels like we are unveiling awesome people, wonderful people in their respective fields who will sit down to hear from them and to learn from them in no particular order. We're starting with Mrs. Iyamu Obi Favor. She's the Principal Program Officer, NACA. NACA is the National Agency for the Control of AIDS here in Nigeria. NACA have been really supportive to adolescents and young persons. They've been supportive to us, to adolescents and young persons in general, adolescent girls and young women, and even supported us through the process of the development of the Gender Equality Fund Initiative country profile. Thank you so much, Mrs. Iyamu Favor. We are happy to have you here. Please, you can just clap for her on the chat box. Please clap for her there. Thank you so much. Ma, if you are here, you can just raise up your hand so that we can give you host access to unmute yourself. And then we also have Mrs. Kadiri Olusheyi Ajimot. She's the Executive Director of the Center for Positive Health Organization, CEFO, here in Nigeria. Mrs. Kadiri has been wonderful as well. Some of us, when we work with our peers or when the older ones that work with the younger ones, right, there's this passion. Mrs. Kadiri is one of those people who is excited to work for adolescents and girls and young women, and we're happy to have on the call. She's one of our Gender Equality Fund Initiative partners here in Nigeria. Please give her a round of applause. We know we cannot clap, but if you're clapping in the chat box, it feels like they're walking up to the stage. And if you clap faster, they will come up faster. And then we also have Mr. Ibrahim Tajuddin Olaiton. He's the Executive Secretary of the Nigeria CCM. CCM is the country coordinating mechanism here in Nigeria, and he has been supportive. He also supported us through the process of launching of the process that led to the development of the Nigeria country profile. And we are happy to have him share that words of wisdom with us all. We're happy to have you here, sir. Please keep on clapping, keep on clapping, keep on clapping. Now you see a wonderful lady. Also, as one of our panelists, we have Faith Onu. Faith Onu is a Gender Equality Fund Initiative ambassador here in Nigeria, and she has been doing a wonderful work as a young woman herself. You know, they said there's nothing for us without us. So if you're discussing about us as young women, you need to put us in the process, right? So we also have Faith Onu, who is one of our panelists today. Please give them a round of applause. And if you're on the call, please, you can just raise up your hand so that Tawanda can give you access so you can unmute your mic. Thank you so much. I can't see my participants list, but I don't know if Tawanda, if you can help me confirm, Tawanda, Grace, if they are here on the call. All right, okay, I can see Mrs. Favor, I can see Faith, and I know I saw Mrs. Kadiri also. Yes, Madam Kadiri is also here. I've seen 3. Is Agatha Tajuddin on the call? Is Agatha Tajuddin on the call? Mr. Tajuddin? Is Mr. Tajuddin on the call? I can't see the entire participants. Okay, I can see Mrs. Kadiri. I can see Faith. I can see Mrs. Favor. All right, someone said he's joining soon. All right, all right, all right. Thank you so much. So while we're waiting, we'll just proceed, and if Mr. Taj joins us, please, you can just quickly let me know in the chat box. Thank you so much. So as I said, it's in no particular order, but then I feel, it's something for young people, and let's have a young woman amongst us to start the conversation for us. So she's going to be our icebreaker, and she's going to start the conversation for us. So Faith Onu, the first question goes to you because we want to hear your wonderful voice first. All right, so Faith, the question is, what are the most pressing gender-related barriers that adolescent girls and young women have? Okay, someone speaking. All right, can you hear me?
Yes, can you hear me?
Yes, I can hear you now. Awesome. Okay. I think that you can mute yourself if you're about to speak, then you unmute, because I think your background is a little noisy.
No, it's not my background. There's no noise there.
Okay, I don't know who else is unmuted. All right, so we can just go on. So the question is, what are the most pressing gender-related barriers that adolescent girls and young women face in accessing HIV, TB, and malaria services in Nigeria? What are just some of the gender-related and pressing, we're emphasizing on the pressing gender-related barriers that AGYW face in accessing HIV, TB, malaria services in Nigeria. The Gender Equality Fund Initiative does not just work on just one disease burden. For instance, only HIV work, HIV, TB, and malaria. So what are some of the pressing gender-related barriers that adolescent girls and young women face? Thank you. Over to you.
Okay, so Agnes, please, can you hear me now?
Loud and clear.
Okay, thank you. So thank you for this question. So when it comes to malaria service, adolescent girls and young women have limited access to care, especially for the pregnant women. So pregnant women have that high risk of contracting and dying of malaria, both in the urban or rural area. So if you look around our society today, women don't have that opportunity to go out there to access services without the consent of their spouse. So you see in most houses, especially from the northern place where I stay, you hear them say bashiga. It means you do not enter except the husband permits you to come in. So some of these women cannot go out there to access malaria service, especially when they are pregnant. And at first, this makes them to be at risk of dying. So that vulnerability and access to treatment is a problem when it comes to malaria. And also when it comes to TB, here in Nigeria, we often see that women's voices are not really heard, although based on statistics, we know that men are more twice likely to have active TB than women. But still yet, harmful gender norms continues to be a source of problem to women. So even in this space, you don't really see women at the leadership position, sharing the leadership position or speaking out for issues affecting them. But I'm happy based on this funding, women are coming up to talk about tuberculosis, to see how they can voice out their challenges and the rest. So when it comes to HIV, HIV is a big issue when it comes to AGYW. So AGYW stands for Adolescent Girls and Young Women. So when you look at the statistics, when it comes to number, young girls and women are likely to contract HIV than men. So this has actually imposed their vulnerability to HIV, and also age-related deaths are more common among adolescent girls and women. So you see that gender is actually a big problem, and gender inequality has fueled all this HIV epidemic across sub-Saharan Africa, not just in Nigeria. So gender inequality is a big issue where women cannot even come out to access services, and due to rape cases and all of that, you see that they have this vulnerability in contacting this virus. So these are some of the challenges, pressing issues that affect adolescent girls and young women here in Nigeria when it comes to HIV, TB, and malaria. When it comes to the leadership position, we are still battling to see how women will continue to be at that spaces where they can talk about their issue, not just talk about their issues, but actually be part of those that implement and solve that issue. So we know that moving forward with this funding, we'll be able to achieve that. Thank you.
Awesome, awesome. Thank you so much, Faith. You know, I was able to pick the cultural and then the traditional aspects of it when it comes to young women, married women and young women accessing some of these healthcare facilities, especially malaria services at the facilities, because of what the community or the society believes in. And then I also picked the part you said, TB programming. You hardly see young women when it comes to TB programming. I'm sure you're speaking to the Nigerian context because this is Nigeria, right? Awesome. I took note of that. And then the age-related deaths. When it comes to adolescent girls and young women. Awesome. Thank you so much. Okay, I have a follow-up question, but not to put you on the spot. So let's just go, let's hear from others, and then we'll also come back to you. Thank you so much, Faith. So the next question is going to be for Mrs. Kadiri. Let's hear from her as a CSO, as a partner, as an organization. So the question is, how does the organization as CEFO, how does the organization consider diversity amongst adolescent girls and young women in program planning and implementation? As CEFO, as an organization, how do you consider diversity, right, among adolescent girls and young women in program planning and implementation? Thank you, Maya. Over to you.
Yeah, good afternoon, everyone. Hope we are all doing well. Yeah, SEPO as an organization working under the JFL Southwest Consortium program, with identifying adolescent young girls and working with them, training them as leaders to advocate and train other young girls and young women at the community. We've actually used a multifaceted approach to consider diversity among these team. What in the aspect of program planning and implementation, we train them, and after the training, we ensure that every trainer comes up like a leader, You are leading the team, bringing other adolescent young girls together and educating them about HIV, TB, and malaria. Why are we making them to lead? Because we want to avoid vulnerability of the young ones. And some of the things we identify are we need to, and some of the recommendation we need to design programs for different age groups. Like the young girl, 10 to 14 years, she doesn't even know her body parts, and she doesn't know where is safe as a red flag for others not to touch. So in order for her to be able to have adequate information about her sexuality and to prevent um, people touching her unnecessarily and also assaulting her in a way that she will not be able to say anything or even threatening her not to talk. So we need to break them into ages, like having age 10 to 14, 15 to 19, and 20 to 24, so that each age bracket can have information that relates to their ages and they can be able to act from that categories of ages. Then we also have a contextual understanding of AGYW. We need to understand what are their economics needs, what are their social needs, what are their cultural and environmental needs. Because it is by so doing that we can know how to design program. I'll be joining them to design program that will suit their ages and their stages of life. And part of what we also do is community engagement. Like I said, we want to meet with parents. We want to meet with community leaders. We want to meet with male partners of the elder ones. We can't just go there as an adult and start talking to them. We want these youths, these adolescent young girls and women to be the one leading. As a young girl of 20 that just got pregnant, what does she know about pregnancy? What does she know about childbearing? What does she know about caring for that baby? So the guy that impregnated her needs to have the information that you need to be there for her. She needs to register for antenatal. She needs to go for antenatal regularly. And while going, there's nothing wrong in you supporting her. And in doing household chorus, you don't need to leave everything to her. So that because she's pregnant at that tender age, she needs parental support as well. She needs psychosocial and mental support so that she can be able to carry the pregnancy well and also do well with the baby and be able to also prevent that baby from getting infected. So, and one of the other thing we do is when we build the capacity of these young adolescents and young women, we realize that they can be a voice at the grassroots to their peers, and thereby they can have the leadership roles and skill to be able to do things better. And there's nothing wrong in adolescent young girls also coming up to advocate for policy that fits into their schedule and their rights and advocate for their right, so that it's not that they should be doing things in the adult way always. No, adolescent young girls has priorities, and those priorities also needs to be heard from them, and it also needs to be followed, and their rights as much as it is needs um to be respected. Then in all this doing, we need to also see a way to do regular monitoring and evaluation for their programming. We need to assess their program, what is effective and what is not effective. They've designed all these programs. They want to implement. We give them time to implement, or we monitor and supervise them while monitoring and while implementing. At the same time, we should have a roundtable discussion after the implementation. What works well, what didn't work well, what needs to be done right, and what needs to be removed, and all that. And above all, I I'm advocating for comprehensive biomedical service, socio-economic support, community-based intervention-led, and service to out-of-school AGYW. This approach, if put in place, will reduce AGY vulnerability to HIV, TB, malaria, and other socio-economic challenges in the society. Thank you so much.
Awesome. Thank you so much. Thank you so much. Yes. We picked it's still coming back to us as we usually say. There's nothing for us without us. When we are
Without.
saying pair to pair, it means we want to be part of the process. And when we are the ones sharing the messages with our peers, they tend to listen more. So yes, peer-to-peer messaging. And then we looked at using multifaceted approaches to some of this programming for adolescent girls and young women, and ensuring it is a tailored programming, right? It is tailored programming and it is age appropriate. And then you made mention of contextual understanding of adolescent girls and young women, and then community engagement. We cannot overemphasize the importance of community engagement when it comes to programming for young adolescent girls and young women, especially that age group of 10 to 14 years, because if you want to work with them, you have to engage their parents or their caregivers. Thank you so much, Ma, for sharing that wonderful knowledge with us. So we'll just quickly hear from Naka. Mrs. Favor, this question is for you. It says, how is NACA, the National Agency for the Control of AIDS, addressing integration of services, that's HIV, TB, and then sexual and reproductive health for adolescent girls and young women? So what is NACA doing in addressing the integration of some of these services?
Okay.
Mrs. Kadri, if you can mute yourself. Yes, ma. Thank you, ma. So Mrs. Favor, I don't know if you heard me, but the question is, how is NACA addressing integration of services, HIV, TB, and sexual reproductive health for adolescent girls and young women?
Oh, okay, so I heard the question. Good day, everybody. So can you hear me?
Yes, we can.
Okay, thank you so much. Thank you, Agnes. Thank you for inviting us here to be a part of this launch today. The question is, how is NACA addressing integration of services like HIV, TB, and SRH for AGYW? NACA, like the name implies, National Agency for the Control of AIDS, we are meant to coordinate the HIV response. And the way we go about our integration is through a coordinated multi-sectoral approach that actually aims to reduce fragmentation and improve access to comprehensive care for all our population, especially for the AGYW. We key actions for us under this very important coordination role that we play is to promote integrated service delivery model, because for us that is the way to go. When you get to a facility or you get to a community that provides services, health services, you should be able to have integrated services, whether for HIV testing, whether for TB screening, for the SRH, which includes family planning, STI treatment. Family planning is kind of still, we are still grooming ourselves for that to include for our AGYW population. But again, that is one key action we usually advocate for, to have integrated service delivery model where you have all the services provided, whether at the community level or the facility level. And then also we do a lot of collaboration. That's our watchword, because not one person can take care of the needs of AGYW. And again, we look broadly at AYP, which is the adolescent and young people, but then AGYW is a subset of that. So we usually collaborate with mostly Ministry of Health and other stakeholders. For this collaboration, we do a lot of, let me just say, recently we had our 7th National Council of AIDS, which happened just last week. And one of the memo that was presented, passed, and accepted, passed and accepted, was a memo on the integration of programs at all levels. Sorry, let me just read the way it is. The memo says, multi-sectorial engagement to support the adolescent and young people program. So that's one key memo that was passed and approved. And so that's why I talked about collaboration. We do a lot of collaboration when it comes to provisions for our AGYW. So when you collaborate with the different sectors, in fact, you are engaging with TB, you are engaging with malaria, you are engaging with the primary health board at all levels. So we do a lot of collaboration to ensure that services are integrated. And I'll just say lastly, so that we can have other questions. We advocate for youth-friendly health services. Now we've passed the level of saying this facility should be youth-friendly. No, we want to integrate facilities and youth-friendly. They understand how to address and provide services for the different population, especially for the AGYW. I think that I will end there. I'll just stop here so that we can ask other questions. Thank you so much.
Thank you so much. Before we have the final rounds of questions, I don't know, Georgina, if you're still on the call before you leave. Georgina, are you still on the call before we leave? It would have been great to hear from you before you leave. Okay, I think she already left. I can't seem to see my screen. I'm just seeing her message.
Agnes, she's still on the call. She just responded.
All right, Ma, if you can just please give us, we'll just give you access to the mix so that we can hear from you. Let's hear your Google message and 1 or 2 words from Global Fund. Please, Tawanda, you can give her access to the mic, please.
Hi, can you hear me, Agnes?
Yes, I can, loud and clear.
Yeah, it was wonderful to hear from you, Favor and Faith, and Madam Ajimot. It was wonderful, and I haven't yet heard Taju, but as I mentioned, Sharon and I are about to leave, but our colleague Emilomo is here and also excited to hear what Taju is going to be sharing. No, Agnes, firstly, really excellent facilitation. This has been a great call on a Monday, full of energy. And it's been so exciting to see the Her Voice Fund and Jeff partners, not just from Nigeria, but also across the region here with you in solidarity. Thank you so much for the work that you've done on the country profile. Sharon and I were looking at it last week and we were like, oh my goodness, there is so much data on HIV, TB, malaria, sexual and reproductive health and rights, all in one space. And as you know, data is key when we are thinking about policy, when we're thinking about programs, when we're thinking about investment. We need to be driven by data. So the fact that you have a country profile that very clearly outlines what is happening in the lives of adolescent girls and young women is really critical. It's an important starting point for the advocacy which you are going to be leading in Nigeria. So I wanted to congratulate you on the work that you have done, to congratulate you on how you have done it. It was really wonderful to hear from the two youth leaders who were part of the process and who shared their advocacy for investments in gender equality and in interventions that really promote gender equality. And also to congratulate you on the ongoing collaborations and partnership. The fact that you have Faith and Favor and Madam Ajimot and Taju here is really a testament to, again, how you are working with others to bring about change for adolescent girls and young women. So congratulations on your work, and yeah, and keep doing what you do, because you're doing it really well. Yeah, thank you, Agnes.
Thank you so much, Georgina. Yes, I like the spirit already. Precious is already clapping, even before I said so. Please, let's clap for Georgina. Thank you so much. Thank you so much to Global Fund for all they do for adolescent girls and young women, for all they do for adolescent and young persons in their diversities. We are grateful. We are happy to have you here join us. Thank you so much. Yes, 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 yes. Our Voice One manager is also saying thank you to Georgina. Thank you, thank you, thank you so much. All right, so I think we'll just go quickly have the final round of questions. I think I have just one more question for Naka before we have the final round of questions. I'm sorry, Mrs. Favor, if I'm just putting you on the spot. So the question is, how is the government? Yes, NACA is government, government institutions and development partners. How are they meaningfully engaging adolescent girls and young women in shaping the health responses and decision making? How are the government institutions and the development partners, how are they meaningfully engaging adolescent girls and young women in shaping health responses and then decision making? I don't know,
Okay,
Mrs. Favor,
thank you so much. Yeah, I got the question. Thank you. And just to remind us of our coordination role also, we might not go into and start implementing, but coordination role. And when I make coordination, we try to provide guidelines in the form of strategies, plans on how to program better for adolescent and young people. And very recently, we developed with the contributions of everyone, adolescent and all our stakeholders, we were able to develop an AYP strategy that is quite different from what we've had before. I always want to talk about the AYP strategy because it is the way forward for providing services for adolescents and young girls. So this strategy, like I always say, has two very broad domains. One is communication and one is stakeholders engagement. And now you're asking how we ensure that stakeholders are engaging meaningfully with our AGYW. Just last week, because I like to be practical, just last week we had a meeting with different stakeholders, and I was so surprised to hear what the provisions that the Ministry of Youth has for our youth in Nigeria. A lot of platforms, a lot of provisions that will benefit, but we do not, most times we don't get to know that these things are available. So one thing that the AYP strategy focuses on is to engage all these stakeholders, whether they are Ministry of Education, and bring them together and have an accountability framework to ask how best can you engage AYP? How best can you engage AGYW? What are your provisions according to your mandate? And remember, we are looking at sustainability, so we are not looking for funds. We are looking at structures that are in place, that have the mandate, and we're asking them, taxing them, taking them, having them accountable and saying, what can you provide? And that we because we launched the strategy, and then operationalization is a process, and we are about to do that accountability meeting where we'll be asking everybody. And by the time we have that done, we believe we'll share it, and every young person, adolescent young person, they see what these different organizations, whether implementing partners, whether government structures, they have in place, things that they have in place for AGYW. Thank you so much. Over.
Thank you. Thank you so much, Mrs. Favor. We cannot overemphasize the importance of data and data-driven programming. Yes, thank you so much. So we'll just quickly have Precious. I think I have a prize for you. You are always clapping, even before I say so. Mary Peace is already clapping. Thank you, and Precious Ayodele. Thank you so much. Yes. So we'll just quickly have the final words from the panelists. Faith, you just go first. Let's just have final words from you after Faith, and then we can hear from Mrs. Kadiri. Thank you so much. Faith, over to you.
So to everyone who is joining this call today, no matter the country, the state where you are joining from, I just want to urge you to continue to speak about your issues and to see how best you can advocate for adolescent girls and young women in their diversities. You have to include sex workers, people from the LGBTQI communities, and also you have to be united, especially the youth-led network. You need to come together to see how you can collaborate, because collaboration matters a lot, because when you come together as one, you tend to do great work. So together we can speak more for adolescent girls and young women, especially the ones in the areas whereby they don't have these opportunities to come and speak out. So when you have opportunities like this, let's utilize it and ensure that we keep speaking for our communities, knowing that we are the ones affected by these diseases. And thus, we are the only one that can create more change. So thank you for joining the call. And to the government, I urge you to keep including young women in your programs. Meaningful inclusion is not just inviting one adolescent to your meeting, but you have to be balanced, involve people from the TB networks and also malaria network in your programs. I know NACA is doing great jobs when it comes to HIV, but you also have to include TB, because there are women living with TB and also living with HIV. So you have to include everyone in your programs. So when you do that, it shows that AYP as a whole is being carried along in the country intervention. Thank you.
Thank you so much, Faith. Thank you. So before we hear from Mrs. Kadri, please, if you have questions, if you have comments, you can start dropping them in the chat box. We can take maybe 2 questions at most. So you can just drop your comments. And then who you are, assigning the questions to. You can just say, oh, I'm assigning to Faith, for instance, I'm assigning to Mrs. Favor, or you can just drop your questions and either of them will pick it so that you can respond. So we can take at least 2 questions or 3 questions. Thank you so much. Mrs. Kadri, let's hear final words from you.
Yeah, thank you so much, everyone, Global Fund and every other partners present. I just want to say we should put it at the back of our mind that the youth has tomorrow. Adults are already outgrowing their time, but the youths have tomorrow. So let's give them the opportunity to learn, to relearn, and to be able to implement programs, design programs in their own way, implement it in their own way. And just like Faith said, NACA should involve every other sectors. The AGYW program should not just be for the out-of-school youths. We should also target the in-school youth. And also, we should put at the back of our mind that the LGBT community also have adolescent young girls and youths and young women amongst them, especially the queer community. So it is a plus that we add them to also let them understand how these programs goes. And above all, the health workers are the maternity centers should also be educated in a way to be able to be friendly and accept our young women when they come in. The fact that she's a young girl, 18, 20, or 21, and got pregnant doesn't mean that she should be sidelined and shouldn't be a target for them to reproach that even hearing the name for the facility is a no, 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 no for her. We should think about the vulnerability we are adding this person to. Even aside she herself that is already vulnerable to HIV and any other STI. Remember, HIV is even like a name. Syphilis is very, very dangerous. It's going to affect her, it's going to affect that child, and anything can happen to either the family. So let the women be friendly to these young girls when they come around and provide services. Give a listening ear. Provide services that suit them. And when a young girl comes to the facility to ask for condom, it shouldn't also be a priority for them to like, you young girl, why are you asking for condom? At least she knows that she needs to use condom to prevent herself. Let's welcome her. Let's give her the opportunity to be able to prevent herself. She's preventing unwanted unexpected pregnancy. She's preventing STI, and she's also preventing HIV, and she's securing her future by so coming to ask for condom. So let's give them a forum to be able to live and thrive with the way that is positive. Thank you.
Thank you so much, Ma. I can see panelists are already getting their accolades in the chat box. Thank you so much. Yes, yes, keep it coming. Yes, I can see everyone is clapping. Awesome, 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 awesome. United we stand. The importance of standing united, right? If we always work together, we are united, we collaborate, we can always push our objectives, we can always achieve our goals and our objectives. If we hold hands together, we collaborate and we stand united. Nothing for us without us. We are not the future, we are the present, right? Thank you so much. Thank you so much. All right. So I don't know if there are questions. We can just take 2 questions. I can't see any in the chat box. I'm not seeing questions. You have questions for the panelists. Do you have questions for the panelists? If there are no questions, I assume that everybody understands. And if you understand, I might most likely just call your name around and I'll be like, you know what, Temitope, and then Temitope will have to respond to, give us a recap of what the panelists had shared. All right, no questions. So thank you so much to our wonderful panelists. Thank you for taking our time to, join this country profile launch and even take our time to be our panelists. It's wonderful to hear from you, to learn from your wealth of wisdom, from your knowledge, from your experiences. Happy to know. All right. Okay. I can see a question or a comment. I'll speak to that. Thank you so much to the panelists. Thank you for sharing with us the wonderful work you are doing as an organization and as the government and as a as coordinators of other organizations and other partners. Thank you so much. We are grateful. Please stay with us. We are about rounding up, but the exciting part is also coming. The most exciting. It's been exciting the entire process, right? But it's going to be more exciting. The next phase of entering is going to be more exciting. We promise not to take much of your time, so please sit with us. I can see there's a comment on the chat box that says, can we have link to the AYP strategy? I think the AYP strategy, if I don't want to respond to NACA, I think it's available on the NACA website. But Mrs. Favor, if you can help me confirm that, maybe in the chat box, if you can help me confirm that. But I think the AYP strategy, it's available on the NACA website. Mrs. Favor, if you can please help me confirm that in the chat box. Thank you so much to our wonderful panelists. Now to the exciting part. I don't know, can you guess? If you can guess the exciting part, you can just drop it in the chat box. Let me know. I'm so excited and I'm just smiling. I'm just so happy, right? The exciting part. Can anyone guess? Drum rolls! Okay, I want to drum right now, but I'm scared before my device will fall down. But yes, drum rolls. It's in the air, it's in the air, it's in the air. Bryce Raphael is looking at me. Can you guess? Yes, please, Deborah, guess. Dance. Okay, Deborah, guess. All right, nobody's guessing what the next phase is. As you're dancing, you can just tell us what the next phase is. Then, Faith. Yes, our Gender Equality Fund ambassador says the launch of the profile. Yes, the main reason why we're here today, the launch of the Nigeria country profile. We're going to have a countdown. Like I see Mrs. Favor just said, yeah. And there are lots of materials that are also available on the NACA website. You can always try to visit some of these government agencies' websites. There are a lot of rich materials that could help in your program's implementation in your respective states, in your respective countries. Yes. So the next phase is going to be the launch of our country profile. The reason we are all here today, and I'm so excited. Yes, Victoria. We are going to have a countdown, but you cannot unmute yourself. So I might help us to be doing the countdown on your behalf as we launch our country profile. And when we are done, I also have a secret to share with you, but it's no longer a secret since I'm telling you. We're going to have a group photograph. So after the launch of the profile, before we all leave, we'll all turn on our camera so that I can see your beautiful and then your handsome faces, and we can take group photographs before we end the call. And after the launch of the profile, we might give a few persons to get feedbacks from them on the profile before we leave. Are we good? So prepare for the camera. If you're not camera friendly or camera ready, please go get ready. No, stay on the call and get ready while you're on the call. Thank you so much. So we're going to have the countdown for the country profile launch. Over to you, Tawanda.
The emperor, the conqueror, the champion, the lion is here. Zobu, zobu, master.
3, 2, 1. Let's go to the cowboys. Yeah. I'm so excited. I've been screaming. It's just that I was muted. You would have heard me. Please, let's clap for ourselves. Let's clap for ourselves as Nigeria, as a country in general, the wonderful body of work. This is beautiful. This is wonderful. Oh my God. I'm so excited for Nigeria. I'm so excited. This is beautiful. Now you might be wondering where you can download this country profile. I'll share that with you. But for now, we want to get reflections and goodwill messages from some of the stakeholders that we have on the call. And we have first we're going to get reflections and then goodwill messages from Global Fund. And I've been made to understand Emilomo Ogbe is still on the call. So Emilomo, if you can hear from you, let's get reflections and goodwill messages from you. Global Fund. Thank you so much. Tawanda, if you can please give her access. Hi, Tawanda. Okay, she's here. Please, Tawanda, please give her access to your mute.
Good afternoon.
Good afternoon, sir.
Good afternoon.
Okay, sorry if you can hear me. I want to start with a sincere apology. I am caught up in another meeting which is supposed to have break between the 12 and 1. So I had earlier thought that I would be, but unfortunately it's not possible. So one, the message is that whatever we need to do, we need to get it done appropriately. And the issue around gender, especially when it comes to youth, require very significant effort. So, and we cannot completely be correct when we say we don't know what government entity is doing, considering the fact that we are member of different platforms. So here now is called for action. It is time for all of us to work together and be accountable for what we do. So for the grant, GC7 specifically, to work and deliver results, we need to be more involved. I want to assure you that the youth representative on CCM most often have information around activities happening within the Global Fund arena. And at every given opportunity, I think you can engage with them, with the representative, and engage appropriately so that we maximize the current opportunity. On this note, I want to thank you for organizing this gender equity platform, as well as call on this particular meeting. Moving forward, I think we should do more by engaging multiple players, including government at the federal, state, and local government level. Collectively, we will win the race. Thank you, and over.
Thank you so much, Mr. Taju. I think that's Mr. Taju on the call. Mr. Taju is the Executive Secretary of the Country Coordinating Mechanism in Nigeria. Thank you so much, Sal, for joining the call, and we are happy to have heard from you. Thank you so much. I think I've made to understand that Emilomo is on the call now. I wonder if you can give her access. And while Emilomo is speaking, I don't know, please, so do we have from our wonderful donors, is Viv Healthcare, someone from Viv Healthcare on the call? Please, if you can just let us know in the chat box so that Tawanda can also give you mic to access so you can speak. Viv Healthcare, if we have representative from Viv Healthcare, please, you can just let us know in the chat box. Tawanda, if you can please give access to Emilomo. I've made to understand that she's on the call now.
Yeah, I have access now. So good afternoon, everyone. Thank you for inviting us to this very important event. I joined a bit later, but just in at the right time to be able to hear some of the messages shared as well as see the launching of the profile. We're very happy to see all the stakeholders here, very impressed by the work being done by Her Voice Fund and all the stakeholders involved in Y Plus Global and AD and all the stakeholders involved in the launching of the profile. Adolescent girls and young women have a great potential to be able to make a difference in the HIV, tuberculosis, and malaria responses, and also to advocate and work for advancing gender equality and rights in their communities and where they serve. And we fully believe in this work that is being done and fully support the advances and the profile launching that has been done in Nigeria. So thank you for the opportunity to be here. We're very grateful and very proud to be supporting this process. Thank you.
Thank you so much, Emilomo. Thank you so much. Thank you for taking our time to join our profile launch. We're happy to have you here. Yes. I know my Nigeria, you know, they're already clapping. Okay, I can see Cabello, if I'm pronouncing the name correctly. They're already clapping. I like the energy in the room already. Thank you so much, Emilomo. Can we hear from NACA, Mrs. Favor, if you can get goodwill message and reflection from NACA? Mrs. Favor, if you can get a goodwill message or reflections on the country profile from NACA. Tawanda, if you can please give her access. Viv Healthcare. Also, do we have representative from Viv Healthcare? Representative from Viv Healthcare. Tawanda, if you can give Mrs. Favor access so she can unmute. Let's get goodwill message reflection from NACA. Let's get reflection. Okay.
Thank you so much, Agnes. If Mrs. Vivo can raise her hand, that would be most appreciated.
Mrs. Favor, please, if you can please raise your hand so Tawanda can, locate you. I think Mrs. Favor is Bliss. Mrs. Favor's name is written as Bliss. She was one of the panelists. Mrs. Favor, please, if you can raise up your hand so Tawanda can locate you. Let's get goodwill message from NACA. All right. I can see Mr. Aaron Sunday is here. Mr. Aaron Sunday is Executive Director of African Network of Adolescent and Young Persons Development and the country lead for the Gender Equality Fund Initiative here in Nigeria. Thank you so much, sir. Mr. Aaron, are you free to unmute so you can give us your goodwill message, reflections on the country profile? Okay. I think Mr. Aaron is unable to mute. Okay.
All right. So thank you very much, Agnes, and good afternoon, good morning, or good evening, everyone. It's a pleasure for me to join each and every one of us on this unveiling of the Nigerian profile. And also, I want to use this medium to extend my appreciation to the country coordination mechanism, Mr. Tadis in the ES, of course, our government, NACA, and as well the UN Women. Thank you very much, and other partners that have also been able to make sure you avail yourself for this significant milestone. Over to you, Agnes. Thank you.
All right. Thank you so much, Mr. Aaron Sunday. I think Naka sadly had to leave because she has another engagement. Viv Healthcare. I'm not seeing any hands up for Viv Healthcare message in the chat box. So yes, you remember I said we're going to have a group photograph. So yes, we're going to have a group photograph. But before then, I'm sure you'll be wondering how you can access the Nigerian country profile. So you can always go to the Y Plus Global website, move down to the Her Voice Fund section, and under resources, you see resources for download. You'll be able to see the Nigeria country profile there to download. You go to the Y Plus Global website, go to the Her Voice Fund section, HVF, Her Voice Fund section. When you go there, you go under resources and you can see the gender equality for the Nigeria country profile, and you can download it from there. And you can also get wonderful materials from the Y Plus Global website. I think, Tawanda, if you can help us drop. All right, I'll take that slowly. That's fine. Tawanda, if you can also, drop the link for us in the chat box. Tawanda, if you can please share the link in the chat box. First, you go to the Y Plus Global website. When you go to the Y Plus Global website, Tawanda is going to drop a link to the website. You go there, then you move down to the Her Voice Fund section. Navigate through, you'll see the Her Voice Fund section. Yes, so they will drop the link in the chat box. You go to the Y Plus Global website, you go down, you locate the Her Voice Fund section, HVF, Her Voice Fund. When you go there, you go under resources and you see the Nigeria country profile. Great. So Grace has just dropped the link on the chat box. You can always copy it and access it. For grantees in Nigeria, I'm sure we'll be able to make that available to you. Yes, we'll make that available to you. Yes, after the launch. So thank you so much. You can now turn on your camera so that we can have our good photographs. Are we ready? So we are right in time. I can see 1:33. Awesome. We did so well. So you can just quickly turn on your camera so that we can have our group photographs and then we'll leave. Just 30 seconds of your time. Just turn on your camera. Let's see your beautiful. Let me put on my beautiful faces because all the wonderful faces I'm seeing, let me put on my glasses because I'm seeing wonderful faces and I need to look at them clearly. I'm excited to see everyone. Tawanda, I don't know who is helping us take the group photograph.
All right. Thank you so much, Agnes. Yes, I'll be the one taking us through this very short session. If anyone who is able to turn on their camera, turn on their camera. And I will count from 3. 3, 2, 1. There we go. We can do this one more time, right? Bigger smiles this time. Okay, here we go. 3, 2, 1. Thank you so much, everyone.
Thank you so much, everyone. I'll give you the rest of your day, and then we'll get to share the links to our grantees in Nigeria. Definitely the copy of the country profile, the links will be shared with you so that you can use it for engagements at your respective organizations in your respective states. Thank you so much, and we'll give you the rest of your day. But Praise couldn't turn on her camera. That's fine, Praise. We have your name, which means you're on the call with us. We are hoping the next meeting we get to see your face. Thank you so much. Bye, everyone.
Thank you. Bye.
Bye.